before starting to a topic, I want to give you a perception about our professional journey. So what is more important where you want to focus on your professional journey? I feel your path and your mentor. If you are right mentor at right time, your journey will be smooth and it will be faster. So thanks to CIPLA team and IHW team who have given a chance to collaborate and engage in this platform where we have had senior mentors, three of our in the industry, which can add value, which can have a lot of value addition in your routine process. So we have with us Mr. Vinod, who comes with the great knowledge of procurement. We have Manisha, who comes with the robust knowledge of operation of pharmacy. We have Mr. Rahul, who comes with, we can say, not only healthcare, other than healthcare also he have worked to diverse kind of industry experience. I'll start with, first we should know what is supply chain is contributing, one, and what are factors which are impacting us. So factors means what is around us of supply chain which is impacting us in terms of improving our outcomes. So what ecosystem is part of supply chain? We have a different perspective. If you ask a person who's working in a pharmacy, he will see ecosystem only doctor, nurse, maybe around the team. But if you see the bigger picture of ecosystem, they are much more than this. So I asked Ms. Manisha about what is this ecosystem.
First of all, thank you IHSW Council and CIPLA for conducting such an supply chain management event for the procurement people working in various healthcare. So according to me, ecosystem is a interconnectivity between the person who are involved in purchasing, the activities which are going throughout the organization, process is involved in it. So until and unless the people who are involved in it is not only the people who are working in pharmacy but other departments, our vendors who are involved, because until and unless the vendors and manufacturers are involved into our process of ecosystem, the process would not we could not achieve the goal, that is the patient satisfaction and the level of service which we want to deliver to our patient. So this is the integration, connectivity between all of the stakeholders who are directly or indirectly connected with the product availability and the process involvement.
Government becomes part of ecosystem because of their regulations, which are the guiding principles of the framework within which we are working. So this entire ecosystem is built wherein various supply chains, it may be starting from say a manufacturing company up to the end patient. Okay, so this is what ecosystem is evolved, and we are a part of, hospitals are part of that ecosystem.
Yeah, so very well taken. I will add the further step that yes, now we know what is ecosystem. So is it the ecosystem working in sync with healthcare? So whatever ecosystem we have, are we integrated? So I'll go with Dr. Vinay. I'll ask how our ecosystem is having the integration or the good communication.
The present healthcare supply chain management, the major limitation of the current supply chain management is that it is based on the demand and supply creation model, which I mean it is confined mostly with the cost negotiations and service. It is not, in most of the institutions, it's not aligned with the corporate strategy, which means it is not connected with the clinical outcomes, performance and the patient safety. Ideally, a supply chain management should be a robust, agile, resilient, most importantly the patient-centric supply chain model. And it should address all the key intervention levels, like 3 three, I can say, because these are the three major objectives in the healthcare supply chain management. One is the process optimization, the second one is the consumption optimization, the most importantly is cost optimization. And this model ideally should address all the key intervention levels. Like when I was mentioning the cost optimization, which should address and which should integrate all the key functions like operations, clinical performance, all clinical areas, and supply chain, and thereby we can achieve the triple game goals: better health, better care, and the lower cost. And this is a major limitation which we are facing, and we should build a, as I mentioned, it has to be, we have to work out to develop our vision should to build a patient-centric, sustainable supply chain model, and that should also address the three elements of sustainability, like social sustainability, economic sustainability, and environmental sustainability. That means the three P's: people, process, and prosperity. So when we implement such things, and we can make the healthcare ecosystem more affordable and sustainable.
So now we understood what is our ecosystem, how it, the impacting. Now, what are the major challenge? If I ask you, which is the biggest challenge in integrating our ecosystem? One challenge which you can share, which will be hindering your performance of supply chain. Mr. Rahul, if you can answer this question, how our ecosystem, which is the biggest challenge, which is troubling our complete supply chain community.
So I will say that presentation was delivered by Venkat. There is one say in Sanskrit, Vyasotishtam Jagat Sarvam. A writer wanted to write something new, okay, and then he realized that almost all aspects of life are already touched upon by Maharshi Vyas. Same way, most of the topics were already covered by Mr. Venkat. So I will just again repeat it. So there are many challenges, but as you said, to address one of the biggest, which I feel, I think it is the communication. Okay. So in supply chain, we have to understand that three things have to move together. One is information, which is related to communication. Another is material, and third one is cash. Okay, so it may be a piece of document which carries the information. So if that document doesn't move, then supply chain gets disrupted. Same way, nursing indent, if that is the piece of information, it doesn't move, it gets affected. Supplier invoice not received in time, again supply chain is disrupted. Say on that basis, we have to ensure that movement of all these three elements have to be together. Then supply chain can be more effective. So in our case, say pharmacy, drugs and medicines which are manufactured by various manufacturers, they trace those on the basis of batch number. That information has to seamlessly move, like it was discussed in previous discussions also, that government is coming up with scheme wherein products will be barcoded. If that happens, it will be a big boon to India's supply chain, wherein entire information related to product manufacturing from manufacturer up to patient, it will be captured, it will become traceable, trackable, so that we know what are the leakages and where product has moved and in whose hand it has gone, and then we will be able to control our supply chains better. Since this particular GTIN, I think it is called as global trading in global trading item number. So it is based on GS1 standard. On that, if that is implemented, then this entire information, like what is the product code name, what is the batch number, and what is the expiry. These are the two elements wherein most of the time this information gets mismatched. While entering, say, GRA or GRN, whatever it's called, if expiry is wrongly put or batch number is wrongly put, then entire system collapses. Or as we know that while dispensing, pharmacists most of the many times, not most of the time, many times they make a mistake wherein product first in first out is not followed, or first expiry first out is not followed, and instead of product batch A1 batch is issued. So those issues can be addressed if we capture the same information in our ERP or HMIS, wherein product name, expiry and batch number is coming from that barcode. It is taken into our ERP, and till issuance of the product to patient, same information is used. Then it will become a seamless process, and we will be able to address that problem.
Even the same part, communication part, which Rahul sir has mentioned, if proper batch number is not being issued to a patient, and if we are not particular about batch number expiry, there may be chances of adverse drug reaction if any patient there is an adverse drug reaction. So what reporting we are going to do to the pharmacovigilance department or the manufacturer? So it is very much important that some process has to be compulsion in every aspect. That batch number is the mandate thing which we have to look upon. MRP, if it varies, it's okay, but batch number, what we are issuing it to the patient, what is the customer going to get, and proper invoice has to be given further to the patient. So if in case any adverse drug reaction occurs, the patient can come back to us and we make a reporting system for the same. Again, the challenges which we face in supply chain is drug shortages, where a communication gap again occurs when we are not being informed as a supply chain managers that this drug is going to be shortage in future, in next week or someday. So suddenly we realize that there is a shortages of medicines, and then on that basis we don't have time to work on it and procure something else and give it to the patient. And if we are in advance we have been informed, it is a part of our role, our responsibility to inform the consultant even that there are drug shortages, so that they can change the therapeutic drug, or they can use some other things which can be used for same condition of the patient.
Among those, the other two panelists, they have covered almost all the challenges that they face. But I would like to place one challenge about to all this challenge. I'm sure you all will agree to it. There is a challenge related to the physician preference, and I'm sure you all will be facing this, because to my understanding, almost all the institutions will be facing this same challenge. The physician, they prefer certain, they have their own choice of plans, and because of which the expenditure will increase. Because this is there's a tremendous pressure to the healthcare administrators, because the revenues are declining, expenditure is increasing, and the one and the only area where the institution can cut down costs is the supply chain. Yesterday, I seen one slide shown by one of the speakers, which it was mentioning that the competition is going to be between the supply chain. That's true. Particularly whether that's a common statement. In the healthcare, the competition is not going to be between the hospitals. It is going to be between the supply chain, because the other costs like the administrative cost, material cost, or labor cost, or other miscellaneous incidental expenses, it going to remain constant. And the one and the only area where one can reduce costs is only on the materials, and that can be done only by the supply chain department. And moreover, now the recent price fixation and capping by the NPP, DPC and all, it has reduced our margin to a greater extent. If you look at our profit and loss margin, the statement, we can easily find out that we are not going on the right track when we compare with the previous years. Ideally, a metal cost should be around in the range of 25 to 26, whereas when you look at the statement, it clearly says that many hospitals are struggling to achieve that figure. And this is a major challenge that I look at, and the main reason what I say is this is mainly because due to the lack of awareness of the physicians on the cost of care delivery, on cost impact of the materials they prefer to use. So when we educate them, when we involve them, and when we engage them in the procurement process, and I'm sure, and also this is my experience in my previous institution and now in the current institution, the periodic value analysis meeting will be conducted with the specialty-based doctors, wherein we present it to the doctors. Like they also have the feel that they are also part of the procurement process. So we will compare, like, see, this is what is the impact going to happen when we procure the site on the annual basis, and where is the other one, the cost activity, and this is without the compromising the quality and other aspects. And when they are involved, when they are engaged, and when they feel that they are also part of the process, there is more chances, more adherence to the cost optimization goal or cost optimization solutions of the organization. And even though if not 100%, I could be able to achieve in my previous organization and also in the present institution 65%. Even the 65% is a very huge amount where we can save. For example, in the present institution, just I have covered, because I joined just I have covered for 1 year, and from Jan, I joined in Jan, and from April to December, and we are selected, like Mr. Venkatesh was mentioning that on the standardization. When we are doing the standardization, and when we are going for the cost reduction, and it was one of the point was cost reduction and margin improvement. When we have implemented it, and we could be able to save 2.86 crore only for the selected items, and we have to 50%. And imagine if we could implement this across the entire continuum of care. This is why I'm saying about the cost saving initiatives that is taking place in the supply chain. And when we implement it, including the capital consumption, and when we do it for in the processes methods, for example, ABC analysis was mentioned in this presentation, and what I did in my organization was, it's like a three-dimensional approach that includes ABC. In the disadvantage of the ABC analysis is that sometimes our focus will be onto the A class and moderate control on B, whereas we don't focus on the C class. Sometimes a critical item may fall under C, so we look to focus on the critical item. So in the ABC analysis, a blend mix of BED also added to it, like vital, essential, necessary. So ABC, BED analysis was done. In addition to it, the lead time analysis also was added. That becomes a three-dimensional. So it's a three-dimensional approach we have practiced in our organization, where we could be able to reduce the inventory holding days. And inventory holding days, in the sense, in generally in most of the institutions, they will calculate overall, whereas we have gone to the category wise.
We'll go again with the basics. If I ask you in pharmacy operations, supply chain definitely is a. In pharmacy operations, we do a lot of multiple processes involved which create an overall gamut. So are we doing enough re-engineering of our process? Can we compare with any other parallel industry? I will give you an example. If I reach home and I wanted to have a feel of having a pizza or burger, I pick my phone, I order, I get pizza. After half an hour I get a constipation. I wanted to have some medication. Will I get in 20 minutes a medication? No. We are not given enough importance to a healthcare practice, to being a re-engineering. And I am very much sure is rocket science is not required. It's not we need to go out of the world and look for a solution. There are some solutions which we might be already paying to the company. We have a system in place in hospital, but no one, we buy Mercedes, but no one teach you there is a back gear also. In terms of IT I am talking. So we need to think what value we can add to a pharmacy. So in same thing I will go with Manish and ask one question. In re-engineering of process, what step you feel which we can add to a pharmacy operation which add value in terms of patient-centric service?
In case of patient-centric service, we can integrate our system with our vendors, and we can even have some agencies where the example which you gave, the delivery of pizza and burger in 20 minutes, and why not medicines. But there are some plans which are in market where they integrate with the hospital system, and they get messages for the medicines on the app, and they coordinate with our pharmacy for a faster delivery of medicines, where they have kept an target that certain areas, not a huge area we can cover, but certain area nearby to your pharmacy we can cover and give the delivery so that the patient get the benefits of getting the medicines within the time. And even if in case of shortages, if we have integration with our vendors who are associated with our hospital, and we have shortage of our medicine, so we are able to see, we can manage our inventory at hospital level lower too, and we can check the inventory at the vendor point, what is the stock level available with them, and the coordination with the third party who have been appointed can be taken care into, and get the billing done from pharmacy and deliver it by picking up directly from the vendors and delivering it to the patient area. So there are systems now coming into process where we are in our hospital, we have started just last month and seeing a positive approach in giving the service to the patients.
So rightly mentioned by Manisha, we need to, there are n number of things now is coming in. If you see, we are the first hospital in India where we implemented a voice bot. So now healthcare team started investing in the tech part. So if you ask me 5 years before, we never thought how now we use RPA. So there's no need of having a repeated call to your vendors. And you can put a trigger points in system where your system will send alerts to your vendors. The delivery is outstanding, or your MIS, your daily MIS, where you are deviating with the compliance. You can have every day morning you come on your desktop, click, you will get a report where you have a compliance division report with the RPA. So now I'll go for Mr. Rahul, how we can enable this data analytics or any other solution of AI based which can help supply chain process in adding the efficiency or better the outcomes.
See, logic is simple. Seamless communication of information, that is the key. Okay. Many companies have started going for supplier portal, for example. So in supplier portal, if the supplier himself can see the PO which you have raised, and his item number and our item number are cross-matched, then when he dispatches goods, the same information can go to hospital, and when the material is received at hospital stores, preparation of JRN will be very seamless, because no need to again look for the information and data. Okay, so to that level, systems, ERPs or HMIs have already become smart. So this ensures that there is a seamless flow of information, and then it effectively improves productivity of supply chain.
Dr. Vinod, I'll come with you. What are the risk mitigation strategy you follow in supply chain operations?
In supply chain operations, risk mitigation, I can say that for any risk mitigation,
Risk of getting counterfeit.
the risk-based real-time data is a vital component for any improvement activity or to run the department very efficiently. And one of the risk mitigation process, I can say, is the business continuity plan, which it was mentioned in one of the state of norms regulation. and wherein we can have plan B for any kind of catastrophic events. For example, in this world, no one can predict such kind of situations. Like, for example, it may be a war conflict, or it may be a pandemic, or it may be a weather conditions. But one can be prepared to overcome such challenges. They can face and they can overcome, and they can bounce back quickly by adapting certain strategies. Like one of the most important one is this supply chain automation analytics, and wherein we'll get the real-time data for handling this situations very much. And the second one is this effective supplier relation management is very, very important to maximize value and minimize risk. Because as rightly said by Mr. Venkateshan, he was mentioning that the suppliers should be treated as partners, whereas the real scenario is not so. They are confined. We are discussing only for financial aspects, and we don't deal more than beyond. We don't go beyond that. We should be beyond the financial aspect. It should be based on the trust and the loyalty, and they should be treated as our partners, and they should be informed about our strategic plans and goals, so that they can align the strategy of their companies to us. And once we have a supply relation management very well maintained, then we can have a that's one. Then the other one in the same we can execute a very clearly defined agreement with those companies that can avoid this unnecessary confusion, conflicts, and misunderstanding. When we have a good relationship, and when we adapt this automation analytics, and when we have the effective inventory control techniques, which was like ABCD, ABD, which I mentioned. Then most importantly, the implementing the Lean Six Sigma management concepts, like identifying and eliminating the non-value added activities in lean management, and identifying and eliminating the causes of defects. So we can overcome all these challenges.
Thank you. Valid point Dr. Vinod mentioned. Now we'll come again back to pharmacy operation. We know now our goals. We know what is our goals. Now is it some kind of we need when we are studying, we used to have a marks card. So we know where we stand. So what we know the benchmarking, we know the scoring. So what are the metrics we should follow, or what are metrics are known in this segment of supply chain and pharmacy operation? So I'll go to Manisha and just which are the metrics of pharmacy operation where you can grade your department, you are doing good, better, or fantastic.
So a goal for supply chain management is three goals are there: fast delivery, and quality of medicine, cost reduction. If we see into this three area, the metrics we have to look into is a vendor monitoring is one of the major metrics which we need to look into, because timely vendor evaluation if we are doing for our vendors who are associated. So whatever the lacking is there, and we inform them on yearly basis about the evaluation which we have done and give them a report. They improve on the area and we are able to manage it properly. Then we have to analyze the time spent. Spend analysis is there, where how much time we are taking for any process of procurement. So time analysis is very much important again. Then third is our team. People analysis is also very much important. How we can utilize the system and release this team and engage them in strategic engagement where we can increase our business. So these are some of the metrics which I feel is very much important.
Yeah, see, she has covered three important aspects. I will put it in a different perspective. Normally, any investment which is done, so there are four types of results which investor will look at. One will be definitely financial, wherein cost reduction, inventory turnover, all these financial aspects are going to covered. The next one will be customer results. So wherein what kind of customer experience we are getting out of our supply chain, our investment, that will be looked upon. is the investment which is made on technology, is it yielding to what is desired customer experience? Are the softwares which we purchase for enabling our say consultant for clinical outcome, is it giving desired result? So this will come under customer results. Then there will be social results. So social results is our supply chain or our investments in supply chain are yielding desired compliance, regulatory required fulfillment. Is it being done? Is our ESG, that is environment, social, governance related aspects are taken care of? This will be supply chain, some of the supply chain targets. And lastly, as ma'am mentioned, last results will be people segment. That is our productivity of our people, is their skill level, which is an issue in present circumstances. What is their improvement in those skill levels, their engagement with our organization. So all these things will be part of our people or employee related results.
Agree with Mr. Rahul and Manisha. So now we know our marks card. So now the major part comes is how we evaluate our performance. So when we have a matrix of pharmacy operations, we have a matrix of supply chain. I'll give you a small perspective of one process of as Manisha mentioned, the turnaround time is crucial for a supply chain, whether it's a pharmacy operation or a supply chain operation. So sometime as a leader we should go on ground and understand each step. If a patient is getting a medication, what is the medication journey? From where it starts and how it's reaching to a patient. What are gaps are there in this process? We need to even see after getting an indent how many steps a pharmacist is taking to pick the medication. Is it some layout changes required? Can we have a rearrangement of goods in terms of FSM analysis, which is fast moving, slow moving and non moving? So now operation part we understood, pharmacy part we understood. Now what are the future prospects are there of, we can say, the market engagement, which majority part of our team have covered in morning. Still we'll have anything is uncovered from my team. If someone want to add something about market engagement, is that something you want to add about vendor engagement?
Continuation of the same metrics.
Yeah, no, marketplace engagement.
Connecting with that. And one metrics I would like to give more importance, for example, the KRS and KPS pertaining to the sustainability aspects we discovered. That can be, because that is going to be the most important KPI value, more weightage for that. Because, like for example, on reduction of the carbon footprint or waste reduction or energy savings and water savings, those aspects, some key metrics to be
Very good. What are the avenues are there for marketplace engagement we can have in supply chain? I think Mr. Venkat and the morning team completely they have talked on aggregation, consolidation. Same thing if you wanted to add something as a topic says ki, what are the avenues are there? How we can have a marketplace engagement? So yes, it comes with the advantage and disadvantage both. So any disadvantage or advantage you wanted to add?
Okay, there's a partnership, like it's more about the supply relationship. As I was mentioning, it should be more than the partners, they should be treated. So that particularly when we are engaging in the vendor, we should be very clear and better to clarify all the points of the before entering into the contract. Actually, the supply relation management starts before placing the contract. While discussing the relationship starts. So whenever we are discussing, keep certain sustainability related points also into the class, particularly about the packaging material, the movement of logistics, and return back policy. And so those important classes when we can to be placed to have a better, not only to have a better supply relationship, but also to make the earth yes, good base for the future generation.
Thank you, team.
Well, thank you so much for sharing your abundant knowledge.